Hello, I'm Dr. Joan McCormick. I'm an audiologist and also a certified dementia care practitioner. Today I want to talk a little bit about the relationship between hearing loss and cognitive health. We certainly know that as we age, our hearing can decrease, and there's a greater incidence of people with dementias. In fact, it's considered to be one of the largest public health epidemics facing us as we go forward. Now, probably 10 years ago, we discovered that untreated hearing loss can result in a greater risk of developing dementia. People that had hearing loss severe enough to create difficulties for them in everyday conversation were found to be 24% more likely to develop dementia. In the beginning, we weren't sure why that was happening. Certainly, a side effect of untreated hearing loss is that people can become depressed, which is also a risk factor for dementia. People can become socially isolated, also a risk factor for dementia. But what we discovered over time and more research was that there actually were physical changes to the brain when people did not treat their hearing loss. The areas in the brain that were responsible for hearing and for processing sound and language actually shrunk. It was just like a muscle. If you don't use it, you could lose it. We also found that people with untreated hearing loss who were certainly struggling to follow conversation also found themselves really focusing hard, giving 110% of their attention. And the suggestion is that maybe that detracts from some other cognitive processes as well. The good news is that a number of recent studies suggest that well-fit hearing aids can help slow the progression of dementia and can also help reduce your risk for developing dementia. Most recently, there was a study published in the Lancet in 2018, July of 2018, that looked at what were the biggest modifiable risk factors for dementia. And hearing loss in middle age was considered to be one of the most important ones, contributing as much as 9% to dementias. If you add that social isolation and depression will also contribute, and correcting hearing loss can help people with that, you could reduce dementias by as much as 15%. That's huge. And I think it really reinforces how important it is for people to have a hearing evaluation, to certainly, if hearing aids are indicated, use them. The other important thing that I think is sometimes overlooked in working with people with dementia is that the symptoms of dementia and the symptoms of hearing loss can appear very similar. For example, in both cases, people can appear to be confused. They can have difficulty following and contributing to a conversation. You may find that the person has become withdrawn and depressed. We also see that people are sometimes less engaged in things they're doing. You may see some changes in behavior or mood. So I think it's incredibly important that before anyone has any memory testing done, that they have their hearing evaluated. You certainly want to make sure that you can hear when you're having memory testing done. One of the important things I want you to take away today is that using hearing aids is not just a wonderful thing to do to improve your quality of life, but it's also something that can help you keep your brain healthy. Think about hearing aids like a vitamin for your brain.